My approach to periodontal therapy is first to control the disease process. That is a relatively straightforward process of cleaning the teeth. It can be done with many different techniques, and I often find that I determine which technique is appropriate when I'm doing treatment. It's a fine nuance in finding the best way to treat each patient. When we start to talk about regenerating lost bone, repairing the defects that have been created by the disease, we've had a lot of different things that we've looked at. In the 50s, we were using plaster of Paris. We advanced on up to coral. At one point in time, we tried glass beads. Most recently, we've been using bone. We've used both bone from cows as well as bone from humans. When it's reasonable and possible, we use a patient's own bone. Often, though, that creates an additional surgery site, and we find that cadaver bone seems to work very, very well. I had some reservations about using cadaver bone initially because I was worried about the possibility of infecting a patient with some foreign object. But I now have complete confidence. I would not hesitate to use bone on myself or my children. I think it's a very, very effective therapy. The other things that we're doing now involve growth factors. We are able to take cells, find what molecules turn on bone-making cells, and those things have been cloned. So now we can go to the store and buy a growth molecule. This avenue gives us some very, very nice results. I will sometimes use it, I don't always. What I have found that in controlling periodontal disease and getting regeneration, I can grade how much of a response I'm going to get from each component. I'll often talk with the patient and say, we can do the ultimate for this, but I think you're going to do great if we only do some of these things. Each treatment is based on the patient's need, how severe their disease has been, and what we have to do in the future. Growth factors and guided tissue regeneration becomes an important element many of the times when we have to grow bone so we can place dental implants. Ultimately, we bring all the tools to play. We choose, and just like a conductor of an orchestra, we'll have each component make its place in the overall package.